It's hard to find someone who hasn't been touched by cancer. It's the second leading cause of death, and 1 out of every 5 people alive today will likely develop cancer at some point in their lifetimes. Still, for many people, talking openly about such a grim topic can feel difficult or even taboo. This is Cancer Chronicles. I'm Scott Gurian, and on this podcast series, you'll hear how the Rutgers Cancer Institute, New Jersey's only National Cancer Institute designated comprehensive cancer center, is trying to spark some much-needed conversation. With the help of Collab Arts, a local arts nonprofit based in New Brunswick, New Jersey, the Cancer Institute organized a series of storytelling workshops last fall, culminating in a story slam back in December. Now, if you're not familiar with it, a story slam is a public event where participants come together before an audience to share true stories from their lives based around a theme. And the theme of this particular evening was journeys of resilience, tenacity, and hope. Over the next 7 episodes, we'll listen back to recordings from that story slam, we'll hear from each of the participants, and we'll learn about what it was like putting this event together behind the scenes. On today's show, we're going to kick things off with Antoinette Stroop, who's known to most of her friends and colleagues simply as Nan. She's a professor of cancer epidemiology at the Rutgers School of Public Health, an investigator at the Cancer Institute, and the director of the New Jersey State Cancer Registry. But cancer isn't just the focus of her work. It's also something very personal. Nan told the story before a live audience about her first-hand experience with healthcare inequity.
I am a native Chamorro from the island of Guam. And if some of you don't know about Guam, it is a tropical island in the middle of Micronesia. It is very small, just 30 miles long. I am the second oldest of 7 children. I come from a very large family. And my father was one of 12, and my mother is still the oldest of 14. In Guam, family is everything. Traditional Catholic upbringing, everything is family-oriented. There's a lot of fiestas, there's a lot of weddings, baptisms, beach days, typhoons, but people don't have to worry about anything because there's always family around and there's always family to be there for you. My dad was very well loved in the village, and he was handsome, he was charming, and he was a fighter, literally a fighter. Maybe it's because he was only 5'4", and he felt like he had to protect his sisters and his brothers, but he was always protecting everyone. He was always around for us. He took us to the beach all the time. It's the one thing I remember the most. And he always wanted us close to him, especially his daughters. He never wanted to leave the island. It was his home and his paradise. I, on the other hand, had to get out of there. And as soon as I turned 18 and graduated from high school, I left. I wanted to go to Maryland and get my degree. And before I knew it, I had my bachelor's degree and my master's degree in Utah, and I was on my way to get a PhD in California. That was in the fall of 1999, and I had enrolled in the doctoral program at UC Berkeley in the School of Public Health. In December of 1999, however, my dad was really ill, and he had to come all the way to California and fly more than 9,000 miles to seek a diagnosis and treatment. And he was in California for a bit and went to UCSF. And the entire time that he was in the hospital, he always asked, "When can I go home?" He asked the doctors, "What can I do? What kind of medicine can I take? What kind of treatment can I have so I can go home?" But he never made it home. He died in California, surrounded by his children and some of his brothers and sisters. And he died from metastatic liver cancer. So I and my sister had the arduous task of bringing him home to Guam. And while I was on that plane, it was dark. You could hear the engines roaring. I was sitting there just devastated, sad, and really confused. How did this happen in such a short time? Why did my dad have to leave his island to get treatment, to see a doctor? Why couldn't he go home and be laid to rest there? Why did all that happen? And it was at that moment that I decided that I needed to study cancer. I needed to study and research why people like me who are from the Pacific Islands or anywhere in the world didn't have access to cancer treatment and diagnostic equipment and good doctors to take care of them. Later on, I would find out that all of that was cancer disparities. And so every day that I study it, I honor my father and build on the legacy for him and for all of the Chamorro people. Thank you.
Nan Stroop joins me now to discuss her story. Nan, you shared how your father wasn't able to get treatment or even a proper cancer diagnosis where he lived in Guam. Talk a little more about what the state of the healthcare system was on the island at the time and why he had to fly all the way to California to get the care he needed.
So at that time, there really wasn't facilities for locals on the island to get the state-of-the-art cancer diagnostic equipment or processes or even treatment. You know, it's a very small island that's very far away from everything. And so it takes quite a bit to get there. And it takes quite a bit in terms of resources to bring to the island for that purpose. And so this happened probably in the late 1990s and early 2000s. And so technology as it is today didn't exist in order for him to get the right diagnosis at the right time on the island. So he had to leave quite frequently while he was ill in order to seek care in California.
And has this situation for cancer patients on Guam changed in the decades since your father's death?
I think it's better. I think there are facilities that have been built since then that have some treatment, like, for example, radiation treatment. It's still really difficult to attract surgeons to come and stay on the island and provide care. I think that's been one of the underlying issues, is just getting healthcare professionals who are really good.
And although Guam is unique in some ways, you've researched and you've spoken about similar gaps in healthcare for people of color in other places. Describe how this is part of a larger picture.
You know, access to care is something that is multidimensional. It's either because of where you live, and it could be very isolated in terms of being in the middle of the Pacific Ocean, or being in a very rural area of the United States, in this country. So sometimes it's a matter of where you live. Sometimes it's a matter of your socioeconomic status. So you don't have the necessary insurance or financial capacity to take on, you know, whatever cancer diagnostic procedures need to be done or treatment procedures. And so a lot of times this is correlated with people of color who oftentimes live in multi-generational households in order to make ends meet. And so they're often at a disadvantage.
What do you think you'll take away from this experience of participating in the Story Slam? Is there some way that you think it will inform how you go about your work going forward?
Actually, I believe that it has already impacted my work since going through that process. I think that a part of me now views all of the statistics that I generate and the data that I collect for cancer surveillance. I view it now through the lens of how am I going to share this information with the public in a more relatable way so that it could really resonate with them and they can understand, you know, what the burden of cancer is in their community, or, you know, why it's so important to follow screening recommendations for their community and their family.
Nan Stroop is a professor of cancer epidemiology, an investigator at the Cancer Institute of New Jersey, and the director of the New Jersey State Cancer Registry. Cancer Chronicles is a project of the Rutgers Cancer Institute through a cross-department collaboration between the Cancer Health Equity Center of Excellence, the Office of Diversity, Equity, and Inclusion, and Cancer Research Education and Training. To learn more about the Cancer Institute's work, visit them on the web at cinj.org. This podcast series was produced by me, Scott Gurian, and the executive producers were Dan Swern and John Keller of Collab Arts, which engages artists, social advocates, and communities to create transformative new work. Our theme music was composed by Dave Seaman. Until next time, thanks for listening.